Good afternoon, everyone. My name is Lori Smith. I am the town manager of Kennebunkport. And if you've lost track, today is Thursday. No, it's not. It's Tuesday, April 14th. Each week, I hear different things, and I try to take a temperature of our community. Lately, I've been hearing a common theme, whether from coworkers, elected officials, or friends. What day is it? Did that happen yesterday or last week? That was 2 weeks ago? Time seems to have lost its meaning when normal markers of time like weekends, birthdays, etc. seem to take a back seat to the sameness of one day blending into the next. Since time is challenging, I thought I would take us back through the last month. Thursday, March 12th, Maine reported its first positive test of the coronavirus. Sunday, March 15th, the governor declared a state of emergency. Tuesday, March 24th, the governor enacted an order regarding essential businesses and operations. Friday, March 27th, Maine CDC reported the first death in Maine related to COVID-19. Tuesday, March 31st, the governor enacted further restrictions on public contact and movement, schools, vehicle travel, and retail business operations. Thursday, April 2nd, the Board of Selectmen enacted their emergency travel advisory order. Friday, April 3rd, the governor established quarantine restrictions on travelers arriving in Maine. Sunday, April 5th, parking at our beaches was closed. Friday, April 10th, the governor issued an order moving the state's primary election to July 14th. So depending on how you count the days, we are 1 month in from our first positive case, or tomorrow we will be 1 month in from the governor's declaration of a state of emergency. Remember back to the middle of March? What was that like? Remember when school was closed for 2 weeks? Remember when people said they couldn't stay home for that long? I often say it's a good thing we don't know what the day ahead will bring, or we might never get out of bed. I don't think any of us could have imagined a month in and we would need to be patient even longer. But you did it. You rose to the challenge, and I couldn't be more proud of you. And the experts say that they see the impacts of these NPIs, or non-pharmaceutical interventions. They say what we are doing is having a positive impact. You made these changes and have helped when no medicine could. Congratulations. By the end of this week, we will have seen our peak resource day, or the top of the bell curve. It does not mean it's over, but it does mean there is hope. Hope does not mean we should relax our current measures, but continue to fight by the same measures you have employed over the past month. Over the next week, we will see numbers continue to rise as we approach the peak. My hope is that all of you will continue your physical distancing, your hand washing, your socialization through phone calls and technology, and your lack of travel. All of these measures will help us see the light at the end of the tunnel. So let's take a minute to express gratitude in these terrible times of COVID-19. I am grateful to Community Outreach Services for gearing up to feed so many in need. I'm grateful for a community that has donated to Community Outreach Services to support their mission and an army of volunteers who came when help was needed. I'm grateful for Vinegar Hill, who not only volunteered their location, when Community Outreach needed a larger space, they rounded up refrigerators to stock the food, and they even organized Easter bags for kids this past Saturday. I'm grateful for Tim Harrington, who donated heavily to Community Outreach at the very beginning, and Batson River Brewing, who have donated sanitizer to our public safety personnel. I'm grateful for Bill Gay and Community Harvest, who supported the local restaurants by buying gift cards and then donated them to folks working during the pandemic. We are grateful for Thermoform Plastics of New England, who donated face shields to our emergency responders. I'm grateful to our police department, who have been responding to some people in dire need during this pandemic and have taken money out of their own pockets to support these people, even if they didn't have a Kennebunkport address. I'm grateful for the Chamber, who has worked round the clock keeping businesses up to speed on the changing laws, regulations, and financial assistance programs. I'm grateful to my fellow town managers and school superintendent, who have been the best of partners, regardless of geographic boundaries. I'm grateful to our public safety responders and employees doing their best to help citizens during a very stressful time. I'm grateful to our Board of Selectmen, who are making the tough decisions, listening, checking in on staff, and doing their best to keep our town afloat and thriving. I'm grateful for medical personnel who continue to fight the battle on the front lines, and the grocery store clerks, and the delivery drivers, and plumbers, and electricians, and all the essential personnel who make our world continue to run. I'm grateful for the entertainers who have found ways to keep us laughing and given us something to talk about besides the pandemic. I'm grateful for creativity and innovation among medical professionals, manufacturers, artists, and just regular people. This is what allows us to not only survive, but thrive. I'm grateful to all of you who are doing what needs to be done, even though you're so tired of it. I'm grateful you are learning new ways to connect, expanding your technical knowledge. And I'm grateful for your generosity and your desire to help when things look bad. Thank you all so very, very much. I hope that each of you today take time to add to your grateful list. Hang it up somewhere where you can see it and add to it each day, whether it's someone or something. Let's continue to remain grateful. So, speaking of two people I'm very grateful for, I'm going to turn it over to Allison and Chief Sanford for their updates.
Good afternoon. I'm Allison Kenway, Director of Public Health for the town of Kennebunkport. And I hope you're all hanging in there as we continue to quarantine in our homes. It kind of feels like Groundhog Day, day after day, repeating similar activities. The days and the activities are all blending together to seem like it's been weeks and weeks since we've been quarantined. I do have to say, despite all this disruption, all the cancellations, all the donning and doffing of PPE to see patients that require care in their homes, I have enjoyed this forced time at home with my kids. I'm in a little bit of a different boat than most of you, as I am still working in the community. It has made my teenage kids stay home, however, and therefore they're forced to be with my husband and I. We've had lots of game nights, virtual game nights with our friends from away, eaten way too much home-cooked meals and baked goods, put together puzzles, watched lots of movies. We've even managed to get some yard work done, too. We are ready for spring, warm temperatures, and to move on with life, however that takes us. One thing I do know is I don't think life will ever be the same again. First, I want to thank everyone in our generous community. Once again, people are pulling together to help out one another, whether it's a monetary donation, food donation, to volunteering to help in any way. We've had people making financial donations to support our local food pantry at the Community Outreach Services, along with food donations to keep filling the shelves. I would like to thank COS for stepping it up and supporting our communities with our food security. We've had gift card donations from Community Harvest to the first responders in town and all those who are working during this COVID-19, thanking them for their hard work on the front lines. These gift cards were from local restaurants for purchasing takeout during this COVID-19. This helps twofold. It supports our local businesses and it shows appreciation for the first responders working through this. We've had people drop off gift cards for gas and food at Bradbury Market for people in need. I'd like to thank Bob Wester from Portside Rotary, who's helped, he's my volunteer coordinator, and he's helped and organize and coordinate all of the volunteers that have stepped up to offer their help. We have this big group of volunteers waiting for assignments. Some have been out already shopping for seniors here in town, and we've picked up prescriptions, and others have delivered them to their home. Some have been pitching in at the food pantry every week. We have some making phone calls to check on people to be sure they're doing okay and they don't need anything. And we still have some PPE trickling in. We will always need PPE between the Public Health Office and the first responders. We've had donations of handmade masks for people to wear in the community when they go out. So please let me know if you need a homemade mask. And last Saturday, Tim Harrington and Deb Lennon of Vinegar Hill, in conjunction with COS, donated and handed out Easter baskets for children in our three-town community. Thank you all for your donations, your phone calls, and your offers to help. It's so much appreciated. And this is a little message from the Parks and Rec. Are you getting tired of the monotony? Do you need some new ideas to entertain you? Well, we've got you covered. These are challenging times for everyone, possibly take a toll on our mental, emotional, and physical and social health. You're not alone. The staff at Kennebunkport Parks and Rec is still providing opportunities to stay healthy and connected with online fitness programs and ways to relieve stress and manage anxiety. Access online programming is on the website kennebunkportrec.com or on their Facebook page or by searching Kennebunkport Rec YouTube channel on YouTube. If you don't have access to the internet, there is also opportunity airing on the town TV channel 1301. If you have any questions or know someone who needs support, please call the rec office at 967-4304, and we'll make it through this together. I just want to talk a little bit about community transmission and household transmission now. The CDC talks about community transmission, and this means the virus is spreading without knowing how a person came in contact. Community spread means spread of an illness for which the source of the infection is unknown. The person came in contact with a virus in the community somewhere. They were not involved in an affected area, location, or a hotspot. The virus can be picked up at the grocery store, pharmacy, public transportation, just by touching surfaces that may have droplets on it from an infected person. Household transmission is the spread of the virus from one household member to another through droplets or infected surfaces. Family members touching the objects in the home then touch their face, their eyes, their nose, their mouth, and then they infect themselves. This all just reinforces the importance of good hand washing for 20 seconds with soap and water or hand sanitizer if you don't have that option. Don't touch your face or your facial features. Wash frequently touch surfaces in your home or your work area. Stay home when you're sick. Quarantine yourself to one room if you have symptoms of COVID-19. Wear a mask when you go out in the community. The CDC continues to report symptoms as fever, cough, shortness of breath, and sometimes a sore throat. If you develop any of these symptoms, please call your primary care doctor first for advice before seeking medical attention, unless it's an emergency. It remains important to get good sleep, eat healthy, exercise for mind, body, and soul, and we'll get through this. It'll be tough, but we'll do it. Please remember to call the Public Health Office if you need food boxes or help with shopping. We have community outreach services ready to prepare food boxes for families in need. Friday morning food pantry continues and starts at 9 a.m. until the food is gone. And a group of volunteers are ready to help shop and do errands for seniors and medically fragile patients. Please don't hesitate to call 967-4401. I also just wanted to remind everyone that these are tough times for everyone involved. Please don't feel you are alone. If you need help with any mental health issues, reach out to 211 or the crisis hotline at 1-888-568-1112. Both are available 24 hours a day, 7 days a week. Please remember to be kind to one another and be safe. Chief Sanford?
Good afternoon, Kennebunkport. Chief of Police Craig Sanford, and also EMA Director. I'm going to kind of carry on a common theme here. I want to have some thank yous because after you do this for a while, you start to get this list of folks that you really need to thank. I want to thank Mr. Tim Harrington for his donations of hand sanitizer to all parts of the local communities, government services, public emergency services, as well as down at the town office. That's greatly appreciated because we can't find it anywhere right now. I want to thank Mr. Bill Gay and Community Harvest for their donations and the support of the local restaurants. I want to especially thank Thermoform Plastics of New England for their donation of face shields. We are able to disperse those throughout the public service community here in Kennebunkport, and it'll be greatly appreciated. I want to thank the members of the Kennebunkport Police Department after they've assisted several folks in need by donating well over $250 of their own money during this tough time. And I can tell you a lot of the officers, their significant others are out of work as well, so it's tough even for them. So I appreciate their donations. I want to thank Town Nurse Allison Kenway for her continued guidance and assistance with this ongoing pandemic. You know, we're not medical specialists, but she's helped us out and gave us direction, and she's pulled us out of a couple of tough spots, and I really appreciate that. Thank you, Allison. I want to thank the town manager for her devotion to the community and trying, no matter the request or need, to find a happy solution. I can tell you the last few weeks have been strenuous on all of us. She always tries to keep a positive attitude, no matter, and, you know, we've got some tough people out there that unfortunately make it tough on all of us to try to carry through these tough duties. I want to thank the Select Board for their consideration in making tough calls, which are intended to make everyone safer. You know, it's really tough when you've got to make a decision that some people are not going to be happy with. I do it every day in the job that I'm at, but it's always an intention of trying to make everybody safe and to treat everybody fairly and equally. So please take that into consideration. And most of all, I want to thank each of you, the citizen, for doing your part to help in this difficult time. I can tell you I've been doing the job for 34 years, and this is one of the most difficult times that I have ever been through as far as a law enforcement officer. So I appreciate your thoughts. I appreciate your commitment to trying to follow the rules, and keep up the good work. I appreciate it. I've had a couple of questions throughout the week about vehicle registrations, so I'm going to try to hit those really quick and the big points. So you can purchase a vehicle, new or used, either in-state or out-of-state, and run the temporary plates which will be issued by the dealership up into 30 days after the emergency has been declared. So when the emergency was declared, I bought a new vehicle just before it or during it. The plates run out in 14 or 20 days. You're still able to run those plates that were issued to that vehicle on that vehicle legally. You can purchase a used car in a private sale and not have a plate displayed. But there are some things you must have with the vehicle. You must display the waiver from the Secretary of State, which can be obtained on the Secretary of State's website. So it's a waiver that basically says, I bought this car used from a private sale, and you know, I should be allowed to operate this. You've got to have the original bill of sale. You've got to have the title with the transfer signature on it. In most registrations in the state of Maine, there's a signature block on the back, but some states don't have that. So only if it's applicable, and any other identifying paperwork, such as old registrations or dealer stickers. You are not allowed to take a registration plate and put it from one car and put it on another car. That's illegal, and it's a Class E crime for which you could be arrested and the vehicle towed. So please, don't just think, you know, it's the Wild West out there and I can take this plate off one car and put it on another one. You can't do that. And you are not able to operate a motor vehicle with a registration or inspection sticker that expired 2 or 3 years ago. We've seen that out there that, you know, everybody's like, well, this is a great opportunity now. I can drive my vehicle that I haven't registered for 3 years and it's uninspected. That's a no-go. Those vehicles, the registrations and or inspection stickers should have expired during this emergency. Other than that, that's it. I appreciate everybody, and I want to let everybody know all emergency services are functioning at full capacity, but I can tell you that COVID-19 virus is real, it is close, and it is affecting people that we love. So please, keep abiding by the orders and guidelines set out by our officials. As with any job, the finish is just as important as the start. Keep up the good work. Thank you.
As Chief Sanford said, some of our town staff have been affected by COVID-19. And I would tell you that if you think it is something that you can live through and that you aren't too concerned about it, I would tell you to rethink that. The symptoms of this are something that are severe. And when you see it with people who you care deeply about, it is heart-wrenching. So please continue to be safe. Today is our fourth, I believe, public safety service announcement, or is it the fifth? Who knows? It's been a month. Well, if you had asked me a month ago when we did the first one if we'd still be doing them today, I would have told you no. So who knows how long we'll do them. People tell me that they are helpful, and I think it's a way for them to connect and know we're still here. As we reach our peak resource day, I am sensing that people are turning towards what's next. How do we recover? How do we get out of this? As we plan for recovery and how we step out of the pandemic, there are a lot of questions I am pondering. I, like many others, believe the way out will be a phased approach. As homeschooling, which everyone's participating in, teaches us, Newton's third law is for every action, there is an equal and opposite reaction. Each step we take out of the pandemic will need to be weighed and measured to understand the effect before another action is attempted. Some of the items on my exit list include lessons learned from this, whether it's emergency response, operations, technology, legal questions and ordinances, coordinated efforts with neighboring towns, schools, counties. What about the economy, summer season, year-round jobs, hiring for us internally as well as externally? What other support actions will we need to assist businesses? In terms of our own operations, there are a lot of human resource questions. There are finance questions, cash flow, budget, reduced revenue, essential versus non-essential personnel. What protocols will we need for facilities and staff? We have election questions that we are approaching the governor with, as well as reviewing our own ordinances and how can we make elections safe and maintain them. And then public meetings. When will we be able to return to physical meetings? How are we going to manage public participation? How will we begin to let committees and boards start to meet again? The Board of Selectmen and I will discuss these various issues in our attempt to work our way back out of this maze and to the new normal. We will keep you posted. Today I will leave you with a quote from one of my favorite authors, A.A. Milne, who wrote the books about Winnie the Pooh. Please remember, you are braver than you believe, stronger than you seem, and smarter than you think. But the most important thing is, even when we're apart, I'll always be with you. Be well, Kennebunkport, and be safe.